According to a recent World Health report, about 7 in 10 women are affected by fibroid, a non-cancerous tumor that grows from the muscle layers of the womb. That's our focus today on Sound Health. I'm Olasumbo Modupe. Welcome to the show. Welcome back. Joining me now to enlighten viewers on managing fibroid is a consultant obstetrician and gynecologist, Dr. Oluwaseun Orekoya. Welcome to Sound Health, Doctor.
Thank you for having me once again.
Fibroid develops between the ages of 16 to 50 years in women. What causes the condition?
Now, from what you said, fibroid is seen in women of reproductive age group. And that actually starts from the age of maybe less than 16, but it has never been seen in women who have not started menstruating. Okay, so it starts from around that period when menstruation starts to when menstruation stops. Okay, so the causes of fibroid really are not known. We know that they are due to abnormal growth in cells of the uterine fibroid. Okay, that is the smooth muscle, an abnormal growth in the cells in the uterus. Now, what leads to that abnormal growth, we can't really say, but there are a lot of risk factors, things that we can say may be responsible or can enhance the growth of fibroid. For instance, now you talk of hereditary. I'm sure you've seen women in whom their parents or their siblings also has uterine fibroid. Also, one other important thing is the environment. It has been found out that black race is associated with more uterine fibroid. Actually, uterine fibroid is commoner among blacks, 2 to 3 times commoner in blacks than in white. And usually also they are bigger in blacks when compared to white. Now, the reason for this is that during the reproductive age group, there are a lot of hormones that are secreted in women. One of them is estrogen, and the growth of fibroid is actually estrogen based. And that is the reason when a woman stops menstruating at menopause, the growth of fibroid usually regresses. So we can say it is hormonal related, and then it could have some hereditary and environmental factors associated with it.
According to a recent World Health report, about 7 women out of 10 develop this condition. Is it true?
Yes, but I will explain. The truth is that fibroid is actually the commonest tumor in women. More than 70% of women, as studies have shown, in some cases up to 77% of women having uterine fibroid. But those fibroids are detected after those women have died and their uterus were removed for tests. By doing some certain tests on the womb, they were able to detect that it is very common. But the truth of the matter is that those 77%, over 70% of women we talk about, most of them don't have what we call symptomatic fibroid. What that means is that there is fibroid, but they don't know they have fibroid because there are no symptoms. You know, some of the symptoms of fibroid, maybe when we get there, include bleeding and some other complaints. But these women, they don't know they have fibroid. A lot of women today, they will just go and do scan and they will say, oh, doctor, they said I have a small fibroid. Many a time, if they've not done that scan, they wouldn't have known that they have fibroid. So, but when you talk about symptomatic uterine fibroid, at every point in time, about 25% of women we have uterine fibroid. Symptomatic uterine fibroid. So 1 out of 4 usually we have a complaint due to fibroid, but generally more than or even more than 70% of women has some degree of uterine fibroid.
Okay, once a fibroid develops, it can continue to grow until after menopause as estrogen levels fall. The fibroid
Usually
shrinks.
stop, yes, after menopause. When estrogen level goes down, the fibroid starts shrinking.
Okay, how possible is this?
Well, as I said earlier on, I said the growth is based on hormones and basically estrogen. So at menopause, usually what happens in women is that the estrogen level drops. And once the estrogen levels drop, it's like you are cutting the source of nutrient to the fiber, so it starts going down, it starts shrinking.
Okay.
So usually after menopause, fiber tends to shrink.
Okay, aside from bleeding, are there other symptoms?
Yes, there are a lot of symptoms a woman who has uterine fibroid could have. Okay, let's group them into three basic groups. Okay, the first one is bleeding problems. Okay, the bleeding most times could be very heavy. Okay, usually depending on the site and size of the fibroid. The ones that bleed most is the one that is inside the womb. They call it submucous. Okay, now the bleeding could be so heavy in such a situation that many a times some of these women could present with anemia, that is shortage of blood, and if that persists, it will lead to heart failure. And unfortunately, we've had cases of women dying from uterine fibroid, which shouldn't be. Okay, so you have the bleeding disorder. Apart from heavy bleeding, sometimes it could be irregular bleeding. We've seen women that when they are menstruating, they can't go out because of this heavy bleeding. Many of them will be indoors sitting on their toilet seat throughout the period when they are bleeding. And many of them will come every month for blood transfusion. So the first problem is the bleeding disorder. Now, the second problem is the issue about the size of the fibroid. When the fibroid is big, it exerts some pressure symptoms. That is, it compresses other organs in the body, like the bladder. In such women, sometimes they have they start going to toilet to urinate frequently. In some women, they may even have urinary retention, they can't go to toilet. In some women, you have what we call constipation, difficulty in defecating, because the womb has actually compressed the rectum, okay, the intestine. And then the womb could be so big that it also compress the ureter. The ureter is the pipe that connects the kidney to the bladder, to the extent that urine will start going back to the kidney and that will actually damage the kidney. So you have those symptoms. That is second group of symptoms. Then the third group of symptoms is the one that is related to fertility. Fertility in the sense that when you have fibroid, sometimes it could prevent a woman from getting pregnant, probably because it's blocking the tube or it's so big that the baby cannot implant. Sometimes when the women get pregnant, they could have miscarriages. Okay, that's also due to the uterine, especially the one inside the womb. And then when they eventually get pregnant, because of the size of the fibroid, it could prevent the head of the baby coming down or could make the baby lie abnormally, which means that the risk of having operative delivery also increases. And then after delivery, because of the fibroid, also could prevent the womb from contracting well. That could also lead to bleeding after delivery. So those are basically the three groups of symptoms a woman could have when she has uterine fibroid.
Can you please share with the viewers the types of fibroids available? Types of fibroids.
Well, I think there is only one type of fibroid, but it could be located in different locations. Okay, now most times we say fibroids are benign, but in some cases I need to say this, especially if you have long-standing fibroid, there is possibility of the fibroid becoming malignant in less than 1%, less 0.5% of cases. So there is that risk of a fibroid becoming malignant. So everyone should know about that. Now, when you talk about the locations of the fibroid, now the location could either be inside the womb, that's what we call submucous. because inside the womb, it usually presents with heavy bleeding. Sometimes the fibroid might be so small, but the woman will be bleeding heavily. Now, it could be intramural. Intramural is when it's within the muscles of the uterus. Okay, that also could give symptoms based on the size, or sometimes could make the inside of the womb uneven and could lead to miscarriage. Then you could have subserous. Subserous is when it's on the outer part of the womb. Okay, now those are the three that are related to the womb. But sometimes you could have fibroids that are not even related to the womb, that are outside the womb. Like for instance, the subserous fibroid could later become pendiculated. That means it will have a stalk attached to the womb, but it is free flowing outside the womb. And in very rare occasions, we've actually seen fibroids that are not in the womb at all, outside in the another part of the abdomen. But majority of fibroids are in the womb, and they are either submucous, intramural, or subserous.
Okay. What's the difference between uterine fibroid and submucous fibroid? Are they the same?
They are the same. It's just the location, the type of fibroid. Let me use that word. Let's use the type so that people will understand. Okay. It's just the type of fibroid. Okay, but the submucous fibroid is within the uterine cavity.
Okay. Does being overweight or obese significantly increases the risk of fibroid?
Obesity is a risk factor. Reason being that a woman who is obese, apart from having her own endogenous hormones, there is a possibility of the body converting excess fat in the body also to estrogen. So with an additional estrogen that could be converted from the excess fat, such women have a higher risk of having uterine fibroid.
Okay, what about genes?
Now, we talked about hereditary the other time, and it actually depends on, and some genes are actually also been isolated, which actually could be passed from one parent to their children. So it is also hereditary, but the truth is that you can't really say this is the cause of uterine fibroid in this patient. What you have is risk factor. For instance, now you talk about early menstruation. Okay, if a woman who starts menstruating early means that such a woman will be exposed to this regime earlier. And a woman who have late menopause, who stop menstruating at a later age also, means that such a woman will have a long interval of exposure to estrogen. Such women are at risk of having uterine fibroid. A woman who has not had pregnancy, because it has been shown that pregnancy also helps to reduce the risk of having uterine, especially term pregnancy. In this era where ladies, they defer pregnancy to maybe 35 and above, we tend to have more cases of symptomatic uterine fibroid nowadays because of the long period of exposure to estrogen and the delay in having pregnancy.
Are there reported cases of complications with the condition? In your earlier responses, you said something about life-threatening conditions like heart failure. What about endometriosis?
Endometriosis is a different condition entirely. Okay, what endometriosis simply means is that the presence of endometrial tissue, that is the endometrial tissue is what leads to menstruation every month outside the womb. Okay, now a woman could have endometriosis following an operation of uterine fibroid. Okay, it is a known complication of it. Okay, but that happens is because during the process of operating, especially when the endometrium, the inside of the womb, is entered into its breach, during the period of repairing, there could be transplantation of some of the endometrial tissue outside the abdomen. That is how that risk comes in. But we try to avoid that risk, and it's not so common. We don't usually have complications from endometriosis following uterine fibroid, but it is good for people to know that is a possible complication. You see, the complications of fibroid are so many. We're just talking about bleeding. What about loss of man-hour? Many a times, what about the pain? Patients, they can't go out, they stay indoor, they can't do anything during that period. So that is one complication. Okay, now the other complication could be due to the anemia. They come for blood transfusion every time. Okay, that complications is one of the reasons that women actually come to the hospital. Then I talk about the pressure symptoms due to the size of the fibroid. A woman could have hydronephrosis, could have a problem with her kidneys just because she has uterine fibroid, especially when the fibroid are so big. And then of course you have complications from infertility to difficulty in having your babies, leading to surgical intervention. So those are complications that women could have from uterine fibroid.
Is there a cure for the condition?
Well, let's say the cure for uterine fibroid will actually be if the woman has entered into menopause and has stopped having what they call estrogen production. Apart from that, the only cure to uterine fibroid is to remove the womb within the reproductive age group. Okay, the reason for that is that when you do fibroid operation, okay, there is still a possible risk where some studies have shown that more than around 20% of risk in 10 years of recurrence. And that's
I was going to ask you.
Yes, but the recurrence, it depends on a lot of factors. Now, for 10 years, a risk of 20%. What have you been doing for 10 years? If, for instance, you have a uterine surgery and you have difficulty in getting pregnant, what we usually advise is that as much as possible, try conceiving almost immediately after the surgery. So if you wait for like 2-3 years, no conception, you should do something and probably go to see your gynecologist so that you will not wait for that long. But the risk is not 100%. It's just about 20% or thereabouts of recurrence in 10 years.
Okay, that has been Dr. Oluwaseun Orekoya, a consultant obstetrician and gynecologist on managing fibroids. Sound Health continues with trending and home essentials. Please stay with us. Sound Health this week. Please share your thought with us on any health issue on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.